Welcome back to our channel. Last time we talked about health and fitness for you and your family during the warm months. This week, we want to talk safety while you enjoy those outdoor activities, namely brain safety. It's easy for us to skip putting helmets on in the hustle and bustle of summer activities, but we're here to tell you why you should take the time to put it on. First, why do we care? A TBI, or a traumatic brain injury, is a major cause of death and disability. There were over 69,000 TBI-related deaths in 2021 alone. That's about 190 every day that year. It's also important to know that some groups are at greater risk of dying from a TBI or experiencing long-term health problems after the injury. These groups include people living in rural areas, racial and ethnic minority groups, service members, survivors of intimate partner violence, people who are homeless, and people who are in correctional or detention facilities. Right now, the CDC is developing a system to track TBIs in the United States to better understand how TBIs affect our nation. The CDC estimates that only 1 out of every 9 concussions is captured in current data sets. This means that resources to treat and prevent concussions are likely not getting to the right group of people. The more we can understand the full effects of TBIs, the better we can treat and prevent them. Traumatic brain injuries refer to damage to the brain caused by an external force or trauma. TBIs can result from various incidents, including falls, car accidents, sports injuries, assaults, and military combat. The severity of a TBI can range from mild with temporary symptoms to severe with long-lasting or even life-threatening complications. TBIs are often categorized based on their severity. Mild TBI, more commonly known as a concussion, is characterized by a brief loss of consciousness, confusion, headache, dizziness, and other symptoms that may resolve relatively quickly. Moderate to severe TBIs involve more significant damage to the brain and can result in long-term physical, cognitive, and emotional impairments. Symptoms may include prolonged loss of consciousness, memory loss, seizures, sensory deficits, and changes in behavior or mood. Symptoms of a TBI can vary widely depending on the severity and location of the injury. They may include physical symptoms like headaches, nausea, or vomiting, dizziness, blurred vision, fatigue, and sensitivity to light or noise. Cognitive symptoms like memory problems, difficulty concentrating or thinking clearly, slowed thinking, and confusion, and emotional and behavioral symptoms like irritability, mood swings, anxiety, depression, and changes in sleep patterns. How do we know when an injury is truly a TBI? Diagnosing a traumatic brain injury typically involves a thorough medical evaluation, including a review of the individual's medical history, a physical examination, and neuroimaging tests such as CT scans or an MRI to assess brain function and detect any structural abnormalities. What can we do about TBIs? Treatment for traumatic brain injuries depends on the severity of the injury and may include rest and symptom management for mild TBIs. Rehabilitation therapies such as physical therapy, occupational therapy, speech therapy, and cognitive therapy to help individuals regain lost skills and improve functioning. Medications to manage symptoms such as pain, headaches, and mood disorders. Surgery to address bleeding or swelling in the brain in severe cases. Individuals who experience moderate to severe TBIs may face long-term or permanent effects on their physical, cognitive, and emotional functioning. These effects can significantly impact their quality of life and may require ongoing support and rehabilitation. Now we know what TBIs are, what they can look like in a person, how to treat them, and what can happen if you don't. But the best thing you can do for a traumatic brain injury is to prevent one altogether. This is where public health comes in. Public health creates educational information, like this video you're watching now, to ensure that our community is better informed about how to avoid the injury or illness in the first place. Two Rivers Public Health recommends taking preventative measures such as wearing seatbelts in vehicles and using helmets during sports and recreational activities to help reduce the risk of traumatic brain injuries. On that note, go forth and have fun while being safe. As always, be happy and healthy. Until next time.